Hey there, my name is Jason. I'm a registered polysomnographic technologist, otherwise known as a sleep tech. I'm having an open and honest conversation with someone who had the Remedy implant implanted. Didn't sound right. Are you someone with central sleep apnea and you don't want to use any CPAP equipment for ASV, bi-level? You're sick of it. You don't want to try it. You want some other type of treatment. This video may be of great interest to you. So Remedy is a treatment for central sleep apnea. It is a device that innervates the phrenic nerve. This basically makes you breathe. It does not open up your airway as your airway is not collapsing. So what it does is it innervates the phrenic nerve and basically tells your brain, hey, you need to breathe now. That's what this video is about. Now, at the end of the video, this video is sponsored by cpapsupplies.com. I swear, this happened organically.
Oh, yeah. And I'm sure this video is sponsored by cpapsupplies.com.
I'm sure I'll work that in there somewhere.
Yeah. cpapsupplies.com. They're super.
With that, there will be no more interruptions. But if you do want to buy any CPAP supplies, check out cpapsupplies.com as they are the sponsor of this video. Use discount code 20lanky, get 20% off whatever it is that you buy. No machines included in that. And with that, I apologize for the audio. His audio is fine. My audio kind of sucks, but he is doing most of the talking, and you can barely make out what the hell I'm trying to ask.
The nemesis of the cat channel. So
Yeah.
we have Belty Cat here. The screen name, the handle, the avatar on YouTube. Now you're on Remedy, and for those who don't know, Remedy is for the treatment of central sleep apnea. The whole science behind it is it's supposed to innervate the phrenic nerve, which is what sends a message to the brain that tells the brain to breathe or not to breathe. And so with central sleep apnea, there's no obstruction there. And this is what you were having primarily, right? Is a lot of central sleep apneas.
That was what I was diagnosed with in 2017. Prior, I was diagnosed with OSA, obstructive sleep apnea, in 1990. So every sleep study I had up until 2017, it said OSA. Went in for one in 17, and apparently I still have OSA. I guess you looked at the stuff I sent you.
Mm-hmm. Yes.
But from my understanding, the CSA was activating before the OSA had a chance, if I understand correctly. But yes. So I have CSA. They determined was my main problem in 2017.
Did something happen to you where you started to have a sharp turn of OSA and then you started to transition more into CSA, central apneas? Did you have like a heart problem or heart condition, anything that you're aware of?
No. The only thing, no head injury, no heart problem. The only thing I did different, starting in about 2001, I had a series of back surgeries. I took pain medication, opioids. Didn't take a lot, but I took them for probably over 15 years. So
Okay.
that's the only change. Now, when I stopped taking them, and tell me if I'm getting too far ahead.
No,
I
this
stopped.
is all good.
Okay, when I stopped taking them in April of last year. Okay, and my goal was, my thinking, and some of the doctors' thinking, not all of them agreed. I could stop the opioids and get rid of the CSA, treat the OSA, hopefully with Inspire, which apparently is not a good idea. But I stopped the opioids. Nothing changed about the central apneas. I had one doc say, "You've taken these things so long, maybe it doesn't make sense to me. You've rewired your brain. You're going to have central apnea forever." Another doc told me, "You're not taking near enough of these things. You're taking them a long time. But you only take small amounts per day. There's not near enough of them to cause CSA." Another doc said, "Once you're off of them a few days, any effect of them is gone." So that is the only change that happened. But when I stopped taking the meds, apparently nothing changed with the CSA.
A lot of different opinions there. So, so you were on CPAP, and at one point you did change your mode of therapy, right? a different type of positive pressure?
Right. I was on the CPAP started in 1990. The machines then were terrible. The masks were terrible. Everything was terrible about it back then. It was difficult. But I did use it, tried to use it. I quit one time in the 2000s for a few months or maybe a year, went right back. But in 2017, to answer your question, in 2017, when the sleep study revealed CSA, that's when they switched me to the auto servo ventilation. And that machine didn't work any better than the CPAP had worked. It really really didn't do it. And the older I got, the longer I stayed on it, it seemed to work even less. I would describe my entire usage of CPAP and ASV is barely worth the effort. That's how I would describe it, going way back to the 90s.
So you used CPAP for a good 20 years and really felt no benefit from it?
Very little. Very it was barely worth the effort. And as I got older, it seemed to get less and less effective. It was just not working for me. I couldn't tolerate it. No matter what I tried, I would wake up and I would have taken the mask off and not know I took it off. So I tried every trick in the book to keep that from happening. I could not keep it from happening.
Were you ever able to look at your data from like CPAP usage or ASV usage? And this is like the part of my head, like, because I do consulting with this, obviously, right? So I like to look for little problems. Were you ever able to look at your data and say, oh, I see I have a huge mask leak, or maybe the ASV setting is slightly off? Did you look at any of that stuff, or was it strictly like discomfort, or you just felt, you know what, I'm just not getting rested. This just isn't for me. I'm sick of it. I'm done with it. I want to try something else.
Well, no, I did not look at the data. The same, no matter where I went to the doctor, this thing was, if this don't work, come back. And so I went back many times, and it would be try the heated hose, try the not heated hose, try the mask liners, the rimsies, try different masks. And I tried multiple different things, and nothing really made a difference. The only thing I did, and I did this on my own before I knew they even made these things, I made myself a hose lift or a hose. That is the only thing that that changed anything at all. It allowed me to actually wear the mask a little bit longer. But to answer your question, I really didn't look at any data. I did not.
Do you remember what pressure you were on at the time? This is pure curiosity.
I don't. I can try to find out.
Did you have anything like dry mouth that you experienced every night or anything like that?
That was not a huge problem for me. Not really.
Okay.
I didn't ever have that people claim to the water. You know, they say they got water in the hose, all that bubbling. My tolerant, to tolerate the mask, I just couldn't do it, long at the time.
Yeah. So, okay. So then central apnea started, they changed you to ASV, and then you said really the same as CPAP, the same experience, just, yeah.
Pretty much.
So then at that point you started looking for other options.
Yeah. Like in 2017, I went on the ASV. I guess it was early last year. I began searching for options. And like many people, I came across the Inspire. I knew nothing about the Remede to begin with. So came across the Inspire, and I just used my backwoods logic there. I think, well, from reading on the internet, if I stop these pain medications, maybe the CSA will go away. I can get the Inspire and be rid of this machine and actually get something that works. So I did. The CSA didn't change. And in my research, actually on Facebook, is where I first read about the Remede. Took it to my doctor. She'd never even heard of it. She's a sleep doc. She never heard of the Remede. So I just proceeded from there, do a little research on it. My doc did a little research on it. She referred me to someone else. And that's how I ended up with the Remede.
Did you have to do anything to qualify for having the implant?
Of course, you had to have CSA. I think there was a body weight limit or a BMI. No coronary problems, but I'm not sure about that.
You don't remember exactly?
Yeah, I don't remember the qualification process. I know my insurance did turn it down the first time. They approved it on one appeal, and of course I had nothing to do with that. I just kept it over to the doc's office, and they got it approved.
Just so looking at their website, I went through it to try to see if what kind of questions do they ask, and it was like percentage of central apneas versus obstructive apneas. That was largely it. And have you failed CPAP? Have you failed ASV? Seemed to be like the main criteria.
Yeah, that's true. Yeah, you did have to be a failure at the others if I didn't mention that.
Okay. So then how did that progress? So you reached out to Remedy, you said, okay, I think I might be a candidate. And how did it progress from there?
Okay. They sent me to a cardiologist. It's about an hour and a half away down at the big hospital at Winston-Salem. Went in, told them my story, just like I told you, how I went through CPAP, it had failed. And he just gave me a quick exam, told me quickly how the Remedy worked. Was I interested? Absolutely. I've done with the machines at that point. He didn't have to ask twice. I'm ready when you are. So went back, had the surgery. The device was implanted in November. I think November 6th. It was activated a month later, and then from there, I went back. Well, I had the after surgery. It's important. You need to follow the post-op directions, and so they told me it's very important to follow directions. Sorry, getting tongue-tied, but I had a lifting limit, 10 pounds. Don't raise my right arm over my head or my elbow over my head. So I was pretty restricted for about 4 or 5 weeks there. The idea is it would pull some of those leads loose internally, whatever. So I did have the recovery, which was not a big deal, but you do need to follow the directions carefully. Went back, the device was activated. From there, it was just a matter of going back and seeing the Respicardia team, and they would make adjustments. And they're really nice people, very accommodating, very willing to help with anything I needed. Go in, they fire up the device, lie on the table. They do a series of pulses with the Remedy. You feel it. You feel it breathing for you, signaling your diaphragm to breathe. And you just go back over the weeks and months, and they just tune this thing into your comfort level till you start sleeping better. You feel like you're doing better. They do give you a safe side. They call it a safe side. So the device will work flat on your back, either side, on your tummy, whatever. But when they start you out, they give you what they call a safe side. And that's if I feel like I just can't tolerate the device working anymore, that I need to sleep, you turn to this side, whichever side you determine that you tell them you want, and the device will shut off. So they give you that. You can kind of ease yourself into it. And unlike the Inspire, the patient really has no control. You don't have a remote control to turn this thing on or off. That's all programmed, and you work with your team to determine what's best for you, the time, all that stuff.
When you say time, do you mean that there's a time that it's active during the day?
Yes. Sorry.
Okay.
Yeah. You work with your team, and it will become active at a certain time during the day, night, whenever you're going to sleep. So mine's 11 p.m. to 7 a.m. So it has to be during those hours, and I have to be laid down. If I'm up walking around, moving around, sit in a chair at a certain angle, it's not going to work. I have to be in the sleeping position for it to work. And if I get up, go to the bathroom, it shuts off. It's not trying to breathe for you if you're up at the bathroom. So I go to the bathroom, it'll shut off. And then when I lay back down, it will give me 15 minutes before it reactivates. And also you work with them on kind of a ramp, like CPAP, when it starts out, it'll start out at a lower voltage, jolt, whatever the term is. It'll start out weaker, and it'll let you kind of drift off to sleep. And then when you're asleep, it'll go into its full activation.
So I kind of have a question about the titration that they did. Like you mentioned, they kind of adjusted the voltage that you're getting.
Mm-hmm. Mm-hmm.
How does that work? Is that purely for comfort, or was there an actual sleep study done where there was someone manipulating it and looking at the actual data or the waveforms and how do you sleep, and then okay, this voltage is better, or was it just based on comfort?
The second sleep study, the stuff I sent you, that was when I had the Remede. So my understanding was when I was asleep, they were making changes and looking at how I was sleeping with different settings.
Gotcha.
So
Okay.
I don't know if the paperwork, the study reflects any of that, but that was my understanding.
It was tech notes. It was that document was like just technician notes, so I could see that they were your cat.
That's Moose.
I love it.
That's Moosey. Come to see. There she is.
I could see where they were increasing like the microvolts to like just I think it was like 2.6 and 2.9, and then they went back down to 2.7. So they decreased it for some reason. So the titration part of it, like that, you said you'll try to get that, so I can show that or share my thoughts on it. But
yeah,
we didn't talk about it before, but basically the original document you sent me of your original sleep study, like I guess before you had Remede implanted, was you had a very high number of central apneas, to the point where, like, for me, my skeptical mind is always like, are these really central apneas, or are they fictitious? You had a number that was so high that it was like, yeah, I'm sure you have central apneas, like no question about it. So then I'm very excited to see that, the next one, how did those central apneas decrease? The one question I have though with that is, if you also had obstructive sleep apneas, is that being, does Remede work with that?
no.
So any residual obstructive apneas would still be there, theoretically?
The doc told me I still had a number of OSA events, OSA and hypopnea, I think was his term. And he told me they were primarily when I was on my back. So Lucy.
I see. So you can just use positional therapy to avoid the supine
that's
position.
what I'm working. Yeah, what I'm working to do. I primarily sleep on my left side, and I've been fairly successful at doing that. So that's I just told him there's no use to start with a machine, because I can't. I've tried it enough. It's not going to work. So that is it. Positional therapy.
Okay. I have a lot of questions here, and they're all
Yeah.
they're all over the place.
Yeah, whatever you need.
So really, I guess probably the feeling. Like, I'm trying to think of what questions would other people have too. So the feeling of it, like you said earlier, you could feel it when you were breathing and they were doing it. Is this something that you can feel at night, like between the hours of where it's activated? Mm-hmm. You can feel it working. Is it something that bothers you? Is uncomfortable? Like what does it feel like to you?
That's if I'm awake, I can feel it. Kind of the goal is to go to sleep before it activates. Now, I read online, there's a Facebook group. Some of the people there say they can go to sleep with theirs active without any problem. I'm not there yet. I need to try to go to sleep before it activates. And if I get up and go to the bathroom, I can still have some bit of a problem going to sleep before that 15-minute window is up and it activates. If not, I have to get up a little while and try to kind of reset the clock on it. But you can feel it. I can feel it. And so I'm working at going to sleep with it active.
Is the feeling like, I've heard people describe like Inspire, which is it's different. Describe that as like a pins and needles feeling. Is it like that? Or like even I've heard a TENS unit?
No, if I use the word jolt, that would be too strong of a term to describe this. Other people have asked me the same thing. So going through the settings when we started, when it's stronger, really too strong, it kind of felt like somebody maybe grabbed your tummy and tickled you. Kind of a strong tickle. Definitely going to get your attention, but not really going to hurt. And if it does, you do feel pain, You tell them during the testing and all that, and they back things off. So it felt like a strong tickle, but it's not like a jolt of electricity or tingle. But as they cut it back, I can feel it, but it's not uncomfortable. You can just, I guess, movement in your diaphragm, and then your diaphragm will just breathe
Move.
for you. Yeah.
Yeah.
It's not, but it's not like an electric jolt. That would be too strong of a term. It's not tingly. It's not buzzy. It's not.
If I put in like a crackling power line sound right now, that would be inappropriate.
You could. You certainly could. I think that'd be really fun.
I did that on the Inspire video. People were like, "That's unfair," and I'm like, "I was just doing it to be funny."
Yeah.
Yeah.
But it wouldn't be accurate, but it'd be very funny. So you go ahead and do that.
That's like all we go for here. So with that feeling, is it uncomfortable? Is it unnerving, or is it just like, you just kind of get used to it?
It is a process to get used to it. Like I said, a lot of people, they go to sleep when there's active, their device is active. I'm not there yet, but I'm getting there. So my goal is to still go to sleep before it activates. One of the questions they ask you when they're testing is, would that, they'll do a series of activations of the device, and they'll ask you, would that wake you up if you were sound asleep? So you just kind of have to say yes, no, maybe. And they if, like, at one time, one of my adjustments, I had them set it way too strong. I overestimated how fast it should be and how strong it should be. So I came home for a week or two, and I called them back. I said, this is just not working. I approved too much of a setting, and they got me right back in, toned it down, and that's it. So they're really responsive, and like, kind of like getting used to CPAP. It is a process. This is not. They told me you're not going to get instant relief. This is not a 2-week or a 2-month process. It's going to take time, and it's taken time, but it's right now, even months ago, it's right now better than CPAP ever was. On its worst day, it's better than CPAP.
Oh, that's fantastic. That's going to be one of my questions is, how is it now? But before we get there, so the surgery in the surgery site, all that, do you feel, is there a lump in your upper, it's right arm, right? I believe it's on this side.
Yeah, over here. Would you like to see?
Yeah. Well, is it something I can show?
Yeah, you can show it. It's I can certainly feel it. If you saw me, didn't know me, you'd have to look at me pretty close to see it. But there's a lump there, and let's see. See the scar?
Yes.
Yeah. So there's
that's not a. I would not call that a bad scar at all. That'll definitely
no. And the worse it looks, the better I like it. So I would. I like
you just tell people
I wish it was
a
little bigger. Yeah. I can tell stories about that. I wish they'd put 2 in me.
You should get a tattoo on the other side and just call it the exit wound.
Oh yeah, it could. Yeah, it's a good idea.
Yeah. So that is the only incision that you have right there?
Yeah, that's it.
Okay. Is it a lump? It doesn't look like there's a lump under it. Is it embedded in there pretty flat?
It's flat, but there's definitely a lump there. Yeah, it's I can feel it, and if you were here, you could touch it. You could feel a flat place there.
So you're overall happy with the surgery, like as far as any, I don't know, complications? You don't feel like there were any?
The only problem I had, and from what I understand, this is pretty unusual. They were kind of puzzled by it. Back in July, last month, I went through a period, like I said, I don't feel this thing working at all. I get up, go to the bathroom, go back. I've been laying there 30 minutes. This is not working. So it took me a while to pin that down, because the goal is always go to sleep so you don't feel it. So went in for a visit, and one of the leads, now this is getting beyond my knowledge here of this thing, but from what I understand, they put 4 leads down to the diaphragm. When they're doing the initial testing and everything, they test all of them, and they program 2 of them, and I hope I'm not getting this wrong. They program 2 of them to do the activating that are the most effective and the most comfortable for the patient. So you got 4. So the device just stopped working. All right. So I went in, they're kind of puzzled about it. I had followed all my post-op directions, all this stuff. I asked, of course, has this happened to anyone else? And they named it. One patient did not follow their post-op directions. And so their device quit working. They had reaching over their head, doing all this stuff. Another person was in a car crash and crushed their device. So it stopped working.
Oh.
And then there was someone else, and I don't know if this was out of the restriction date or not, was doing some lifting of some really heavy weights. So things stopped working. So the good news is they got 3 more leads to work. So this one stopped working. They don't seem to know why. I certainly don't know why. I had hit it with a seat. I'd let a seatbelt go. It hit it months earlier, but they don't seem to think that caused it, because I had multiple tests after that and everything was fine. So that is the only problem I've had with it. But you've got 3 other leads. They picked 2 more. We went through the testing again, and it's okay. The leads they're using now, there is maybe a slight bit of discomfort if I'm laying on my right side, but I've gotten used to it. It's very minor. I suppose these leads are put in there in case something like this happens. I don't really know.
Yeah,
But
some redundancy, sounds like.
Yeah,
just
I guess.
for exactly what happened to you, right? It stopped working, so you have some backups.
Yeah. But from what they told me, that's really unusual, because they were very puzzled. I didn't have certainly not lifting anything heavy. I've not had any trauma to the site. I've followed my post-op stuff to the letter, and then had many tests. I had many appointments where they tested this stuff, and it just stopped working. Don't know why. So I hope that don't discourage anybody from looking into this thing, because if it stopped working again today, I would be back down there to get another. It's so much better than CPAP.
ASV in your case, right?
Yeah, or ASV. Yeah.
Well, and CPAP ASV.
And I'm just speaking for me. I know CPAP or ASV. I hope to talk about it a little. CPAP and ASV works good for some people, and I hope it works great for a lot of people. For me, it was just such a miserable existence. It did not work. And this thing here actually works. It's the first thing that's worked since 1990.
That reminds me. I was gonna ask you about that as well. Had you ever tried just like supplemental oxygen?
No.
For the central sleep apnea?
No.
That's something. See, that's something that's kind of new now. Like, and it's more for like, just actually people that would be on ASV that have chain stokes or just a high number of central apneas, is they'll put them on supplemental oxygen with or without CPAP. And it seems like it almost works better than ASV, or it allows you to stay on CPAP to handle the central part of it, but then the obstructive is still worked with CPAP, which wouldn't work for you because you were not digging CPAP. But it's been a little bit of shift in the way people are treated for complex sleep apnea. So I wanted to ask you also about the battery. Did they say anything about how long the battery lasts, or is it rechargeable like externally?
It is not an EV. It is not an EV. You can't. It's one and done. I think it's about 5 years. About 5 years, I think, is the time. So they check that every time I go in. They say you got this much voltage left, whatever. So I think it's about 5 years.
So when it comes time, like 5 years is up, you about out of juice. Do they open you up at that point? Can they check the other lead? Is it that easy, or is it something that they would have to be a little more aggressive to replace the lead?
As far as the battery, they do just open you up, put a new one in. I don't know what they'll do about if they'll check the lead. I don't know if it's more complex surgery to actually look at it. As long as these are working, I told them I don't care. They told me that they didn't think they needed to take it out, and I said that it's all good with me. I don't care. Just so it works. And but from what I understand, it's just simply open you up, put in a new Duracell, and send you off. But there's no recharging.
They can't just lay you on a charging pad. Like, it's not
no wireless charging with this one. No, none of that. Can't you
bad.
pull up to the Tesla station? I do some icing. Yeah, I'm not an EV, but I put the cord in there, like a park in there, steal a parking space. Do they do that there?
You get some Tesla dude tapping his foot at you, arms
Yeah, yeah, like the guy with the ice engine pulls up there to the recharging station, puts the cord out of the wheel, and goes in the store.
Oh yeah, oh yeah.
Okay, yeah, I
Yeah.
can't do that.
People get irate. It's amusing to watch. So, okay, so really the final question is, I mean, you already kind of said it, but as far as now, how is your experience just sleeping? How you feel during the day? How is it compared to just like say, I don't know, 5, 10 years ago?
5, 10 years ago, I'm much better, a lot better. As far as normal, I don't know that I've slept normal my entire adult life. I was 25 when I was diagnosed. I've thought back many times. I think I had at least OSA when I was a teenager. Just thinking about how my energy level was, how the brain fog and all that stuff. So as far as normal, I don't think I'm normal yet. It maybe as compared to other people, but much better. I'm much better now than I was a year ago. I do definitely feel like I'm still in the transition period with Remedy. I don't think I'm reached its maximum. I'm completely used to it, but there's absolutely no way I would go back. There is no downside to having the Remedy. When I had the machine, CPAP or ASV, if I got 4 hours a night, that was a good night for me, and that did not happen very often, where I could sleep solid for 4 hours. With this thing, 4 hours is kind of a bad night. I can usually squeak out 4 hours at least.
I think that about covers everything I have, and I'm sure when I'm editing this, I'll think of 1,000 more
Okay.
questions.
Well, you're
But
welcome to call me back. Yeah.
you
Uh,
bet. I mean,
I'm
for my channel nemesis, you're. I mean, we obviously don't get along at all.
No, we
So
don't. And we'll keep that up on the, and I'll tell you this, when you do the video, if people put questions in the comments, I'll be glad to answer them. If you do stuff about EVs, I'll still try to be mean to you as much as I can. I did write down a few things that you wanted to tell you about the device. So we covered the post-op. That's really important. Another thing to know, when you have daylight savings time, that's automatically built in here. So I don't have to think about it. It changes over when daylight savings time, and all that's automatic. I don't have to think about it. Also, if you travel across time zones, you tell your team, they will set this thing up to accommodate whatever time zone you're in for the days you're there. And then when you come back to your home time zone, it'll.
So you don't need to go in for that. It can do that automatically.
No, I have to go in. I do
You
have to
do.
go in
Okay.
for.
Okay.
Yeah. But okay, now the daylight savings time is automatic. I don't have to go
Okay.
in for that. But if I was going to travel in a few weeks, I was going to go out there to California and hang out with you a while. I just go in, tell them what days I'm going to be there. They would set it up for, I guess, Pacific time, and I wouldn't have to think about it while I'm there. And then when I got back to North Carolina, it would automatically on the day. It's not GPS, it's dates. So I just tell them what dates I'm in what time zone. So they do that. The MRI, with this thing officially, I can't get an MRI with this thing. Although I did read online that they are MRI approved now, but they have to turn it off. But
Okay.
you'd have to go in and get it shut off, do your MRI, get it turned back on. But that's not official. I've not heard that officially. I just read it online.
So instead of that, you'd have to do like CT scans instead.
Yeah,
Okay.
I guess be the thing. Yeah, X-ray or CT scan. Yeah, but that's not official. I haven't heard it officially. The only other thing I did want to comment about sleep apnea. I was not a casual sleep apnea sufferer. Sleep apnea just really put a dent in my life, in my memory, in my energy. It really dominated my life for a long time, for a lot of years. And that's why I tried. I kept trying CPAP, trying ASV, hoping it would work. Had huge memory problems, huge brain fog problems, and sleep apnea. As it really can rob you of your life. So I would encourage anybody, whether you get a Remedy or whether you try the CPAP or ASV, and just because it didn't work for me, the machines didn't work for me, don't mean it won't work for somebody else. If you have sleep apnea, I encourage you to not give up, to keep seeking treatment. It took me a long time before the technology caught up to my problem, but it finally caught up with me. And I don't feel like I've maxed this device out. I don't feel like I'm as good as I'm going to be, but my life, my memory, my sleeping is so much better than it was. It's just remarkable.
I'm glad it gives you the energy you need to heckle me for years to come on my
yeah. It's
yeah.
hard to think of quick insults for an EV if you're half asleep. It just, opportunity really passes me by.
You've been doing a great job. So yeah, that's important. So you're in a, like, I don't want to diminish what you said, but I just recorded a video that I'm going to be uploading today, and it has to do with the biggest scam of like the sleep medicine industry, and it has to do with the way people are put on CPAP. It's like ASV and go home and forget about it, and the follow-up is so terrible. You're in a different category.
Yes,
you're definitely in a different category, but it's important to, like you kind of said, go through the steps. And how do you feel about that? My impression is go through the steps of non-invasive, non-surgical things, and once you exhaust those and you feel like, hey, I've put in the work, I feel like I failed them, it's not for me, then go ahead and look for other surgical options. Or do you feel like, you know what, I wish I just would have done Remedy first? I know that's kind of hindsight, but you tried it for 27 years or so, CPAP,
a little over 30 years. CPAP and then ASV. So I reached over 30 years. I tried it longer than anybody I ever knew tried it. But no, I agree with you 100%. Try the less invasive stuff. Try your machines. Do what your doctor says. If that doctor's not helping you, go to another doctor. Absolutely. Try the easy stuff first. But if it don't work, don't give up. The thing about you had a video about this, I think some months ago, about how the follow-up care for the machines was pretty weak, and I could not agree more. I couldn't agree more. If I had met you 20 years ago, maybe I wouldn't have this device. But the follow-up care is just not there. You get the machine, and I'll even go into this. You may need to edit this out, but anyway, when you get your machine, the first thing they tell you, if the doctor don't tell you, the DME provider will tell you, take this machine. Oh, there's Stewie. Is that Stewie or the older kid?
Yeah, no, this is Stewie. Yeah. Hey, no, keep going. He was clawing the hell out of my legs.
Yeah. Anyway, the first thing they tell you when you get your machine, the doctor or the DME provider says, take this thing home. The insurance is not going to pay for it unless you keep it on 4 hours a night. I think that's the time, for 30 days, 90 days. So right off the bat, right, as soon as you get it, you're playing fake it till you make it. So you take this thing home. They say, read book, read a book, watch TV, whatever you got to do. Just keep it on 4 hours. Never mind if it's working or not. You just want to keep this on you until we get our money. Okay, that's a little crude, but till the DME gets paid. Once they get their money from the insurance, their motivation to help you is zero. So that's another reason I don't think I'd be on CPAP, because as soon as they told me that, I'd say no. I'm not. That's the only medical treatment I know of that they're going to give you, and they tell you to pretend it works for a month or 2 months or whatever. And then after you've pretended it's working, come back and we'll fix you. And I've heard that every single time I've got a machine. That's just the patient, once they get paid their money, their motivation to help you is nothing unless they can sell you something.
Resupply of masks and accessories.
Yeah. And that's just, that, you probably know that better than I. But people like, I never encountered anybody like you outside my docs that, help you, or, there's just, the people just weren't there. And I don't think I could find anybody like you in North Carolina.
Sleep apnea is of itself, it's, not a scam. It's obvious people stop breathing, happens all the time. But the way things are set up, it's in such a way that there's gatekeepers of, we can't give them this information because if the patient has this information, they're going to go do some crazy stuff. like what? I don't know. But the
Mhm.
metrics they look at, what's your apnea hypopnea index, and like you said, how long are you wearing it? That means absolutely nothing.
Mhm.
And so like you really have to have someone that dives into the data and kind of understands it and can communicate that effectively of here's why I think you need to do this.
Mhm.
But that just doesn't happen. So in your case, like I said, I don't think that applies. You have true central apneas. ASV is not appropriate for everyone either. So I mean, I think Remedy for you actually it makes sense. It's kind of compelling. It makes sense for you. And I say that even though I clearly hate you and you clearly hate me.
Yes.
And hey, I'd still want to say thank you. I'd say this on camera or off. I know it's recording, but it was really these kind of honest conversations. Like if someone would do this with me with Inspire, like I told you, I was having a hard time finding someone with a positive thing that didn't say you're going to bend it and twist it to make it seem like all this stuff. I don't care. I'm not married to CPAP by any stretch. If it comes out that Remedy is the cure for everyone, I would be doing Remedy videos. Probably not as
Yeah.
many because there's a lot to talk about, but I would start promoting Remedy if that's what works. I appreciate you spending the time being so open and honest because you're even saying like this isn't perfect. It's a process. There's a
And
little
it
work to
failed.
do.
It
And
failed one time. I don't mind telling you that.
yeah, and that's like CPAP fails a lot for a
Yeah.
lot of different reasons. So
Yeah.
it's these things. I think they're like marriages. Yeah, you get married, everything's great at first, maybe, and then you think you're cruising along and it's good, but you still have to keep putting work into it.
Mhm.
Just because you get it set and it seems good, you still got to work.
Well, I appreciate your interest. I will, if you ever want to talk again, you know how to get me. Uh, I'll answer any questions I can. I will work on getting that other information. I'll look back on some of our other YouTube encounters, and you mentioned something called waveform data. Was that in those?
Yes.
Is that something you
No.
want?
So yeah, I mean that would be great. That's going to be near impossible to get. You would actually
Okay.
have to ask for your raw data file. So it's going to be in an EDF format, which is what
Okay.
sleep studies are all done. You can ask them what system they have, and that would be kind of helpful because I have a lot of, excuse me, I have a lot of the software for reading it. If you
Okay.
could get the actual sleep study, that would be awesome. Like the raw
Okay.
data, they're going to be like, "Why do you want that?"
And now
So
is that from both the pre-remedy and the after remedy, both of them?
if you had both, that would be the holy grail. That'd be amazing because
Okay.
I mean, I'm super skeptical because a lot of some scores are really good, and that's the person who goes through the raw data and says, okay,
Okay.
this is an obstructive apnea, this is a hypopnea, this is a central apnea. It
Mhm.
helps to have, sometimes you get this person who's maybe conservative and this person that's wildly aggressive in how they score. And so
Okay.
it's like, it's kind of hard to compare the two, but if you have the same person do both, at least you have probably a fair comparison for how things changed.
Okay.
So
Okay.
if you had both, I would love to rescore them both and just see what they look like.
Okay.
Um,
Could you have time to let me make some notes? Tell me exactly what to ask for. Do you have time?
Sure. If you got those, that would trump everything else as far
Okay.
as
Okay.
the excitement level of this guy.
We'll see what we can do. We'll see what we can do, brother. Would that come to you in like an electronic form, or would that be printed, or I guess PDF would be
Electronic
electronic.
electronic format. Yeah.
Yeah. Okay. This is it. I'll see what we can do. Then we'll try to get that for you, brother.
Yeah.
And I
Sounds good.
appreciate your interest. You're a good guy. You take care of cats. Your cars are crap, but that's okay.
I think that's it. I just want to say thanks again for
Very
being open
welcome.
and honest
Very
about this.
welcome,
This
brother.
kind of
My pleasure.
this kind of stuff is super helpful to a lot of people.
Clean your stinky mask with some Mask Bright, available at Amazon. Thank you to all watching, but an extra thick thanks, buddy, to Doug Toombs, Jason Georgiades, Patricia Espelong, Sarvesh Joshi, Stuart Hetherington, Mona Swearingen, Chengtu Chen, Edward Steiner, Deborah Permute, and Shannon Kerr, and another slightly less thick thanks, buddy, to all the other YouTube members, Patreon supporters, and other stuff.